I think that women need to have a choice. Choice is so important, especially when it comes to suffering from heavy menstrual bleeding or pain. And when we can provide a woman with choice, then she can be armed with the opportunity to make the best choice for her and her family. When we don't have choice, then women are going to suffer under the needs of the physician or the surgeon or the hospital in terms of their management. And nobody wants that. Physicians don't want that, and patients don't want that. Minimally invasive gynecology is my passion. It's what I love to do, and the reason I'm so passionate about it is that it offers a woman a quicker recovery. There's less risk, and the outcomes are fantastic. To see a woman have a laparoscopic procedure and be home within a few hours with very little pain is amazing. Even women who need more extensive procedures can have a laparoscopic approach, or even better yet, a hysteroscopic approach. Hysteroscopy is where we put a camera into the uterus, and then of course laparoscopy is where we put a camera into the abdomen. But these approaches really make a difference because of the recovery and less pain. Hysterectomy can be a very good operation. It can be a life-saving operation in many instances as well. And the indications, which include heavy menstrual bleeding, fibroids, and of course cancer, are very important to consider. Traditional hysterectomy has been done by a large incision or a laparotomy. An up and down incision called a midline laparotomy is quite invasive. It results in a longer recovery time. A patient can be in hospital for 3 to 4 days, and there's definitely greater risk. In our own work, we've shown that there's a 5 times greater risk of complication, including infection, bleeding, readmission to hospitals, and even blood clots. So when we do offer a hysterectomy, we want to do it in the least invasive way possible. So you try to make what we call a mini laparotomy or a mini incision, or do it vaginally, which is actually probably the least invasive approach. And if you can't do the hysterectomy vaginally, then a laparoscopic approach or with small cameras is the best. I think that as frustrating as it can be, the symptoms, the wait times, I think women need to arm themselves with information. Now, if they're watching this, they've already started towards the right path. The more information you have, the better. I often see patients who come to me who say, I'm here for my hysterectomy because I'm just fed up. And what we often can do is provide them with more information and give them the whole list of alternatives that are available, whether they be medical or surgical. There's so much there. And in fact, we have a higher satisfaction after we've given them the options and then allow the patient to make the decision. The minimally invasive routes for surgical procedures are by far superior to many of the hysterectomy cases that we need to do. So I think when we give that option to women, they're very happy with it.
And are there cost savings to be had for our healthcare system too?
Yeah, definitely. And in our own hospital in Ottawa, we've shown a significant improvement in terms of decreased length of stay. So women are not staying in hospital anymore after their hysterectomy or other minimally invasive approaches. When we avoid these major operations such as hysterectomy, or we offer at least a minimally invasive route, the benefit is not only to the hospital, but to the healthcare system. If I can keep women of reproductive age out of the hospital because I can make them better and happier and more productive, then we can save the important hospital beds for patients who have cancer or need joint replacements or other very serious conditions. So the Ottawa Hospital has been a leader in investing in minimally invasive surgery, and this started when I was recruited here over 5 years ago. And one of the big things that was possible was this minimally invasive surgical suite. So when a woman needs a diagnosis, she no longer needs to go to an operating room to take a look inside the uterus for problems or other issues. We can now do it without any anesthetic while the patient's awake with a tiny, tiny camera, which I hope you'll get to see, that measures about 3.5 millimeters. And in addition, not only that, we've now moved ahead to provide women with procedures in this small surgical suite. Again, with very minimal pain medication, we can actually do something called an endometrial ablation, which is a burning of the lining of the uterus in cases of heavy menstrual bleeding. And we can do that all right here. The women are back to work within a day or so. And if we don't give any anesthetic, they're back to work that day if they'd like to come. And the last thing actually I should tell you as well is we actually also offer an alternative to tubal ligation. So for women who don't want any more children, instead of going to the operating room, we can actually block their tubes right here without any pain medication. And again, they're back to work the same day, and it's much safer and more effective. There's only a few places that are actively doing this type of outpatient office hysteroscopy, we call it. Even though it's in an organized place, it doesn't require the anesthetic that is required in the main operating room. And also think about the cost savings as well of doing it in a small setting outside the main hospital. It'd be great to have more minimally invasive surgical suites across Canada, but you always need people to staff it. What we really also need is people with experience and training to provide the best care. And they can do that in their environment in the smaller centers just as well as the big centers. But people matter just as much as equipment. You can build it and they will come, but if you have nobody to host them, it won't happen. I think the current state of training is not at its best. I think we can do a lot better, and we have many people across the country working on just this point. And I think as time goes on, we want to see more people trained in minimally invasive options, and so we're going to move forward with looking at projects that can do that, including fellowships, which are training opportunities after graduation to improve minimally invasive surgical skills. This is our office hysteroscopy suite, our minimally invasive surgical suite, and what it offers is an opportunity to take cases that would normally be done in the operating room, outside the operating room, and save both money from a hospital expense point, but also save women from the unnecessary risks of general anesthetic. It's really an opportunity to provide minimally invasive approaches to common problems. So if a woman was to come for a case at our suite, we would actually have her present, and we'd go over things and make sure everything is well reviewed. And our bed would certainly be set up with stirrups in place. And actually, in most cases, we don't even use any anesthetic. So without any pain medication, we have a very small camera that we can use to guide us to provide an image that is high quality. It's a high definition camera, and it can look inside the uterus very nicely and make a diagnosis. That's traditionally been done in the operating room under general anesthetic. And once you actually take a look inside, you can then either decide to treat or plan your treatment if it's a bigger surgery that's needed as well. So what we have here is a high definition camera, and it's of the highest technology, and the image is incredible that we can get. And what we end up doing is attaching this to a hysteroscope, and I'm going to show you the hysteroscope right now, which is a long instrument, which is actually a lens, which allows us to then insert into the vagina and into the uterus as well. So the camera goes at the end of the hysteroscope here, and by doing that, we can then take a look as well, and the light goes through. The quality of the image is fantastic, and that's the difference, is that we no longer have to wonder what's inside the uterus and what's causing heavy bleeding or pain or whatever the issue may be. We now have an opportunity to really take a look with quality that's incredible. So I'm going to take a bill here and just take a look, and we're going to focus in on it to allow us to see how high quality that picture can be. And so here we are taking a look at our picture, and it really is fantastic. And in fact, we can see the watermark. I don't know if you've ever known there's a watermark there of the Queen in the $20 bill as well. There's one more procedure that we offer women to really avoid hysterectomy, and that is endometrial ablation, which is really a burning of the lining of the uterus. And that will allow a woman to have a significant reduction in her bleeding. Over 85% of women who have that procedure done, when their indications are correct, are satisfied. And many of those women can avoid hysterectomy. Even those women who end up getting a hysterectomy later down the road are still happy that they tried a less invasive route first. And I think that's very important. And so we can offer that here with very little pain medication, just some pain medication that goes through an IV, and the patient goes home the same day and she can be back in work within a day or two.